Cytokinesis, beta blockers, and congenital heart disease. Definition: cytokinesis is the process of separation and fragmentation of the cytoplasm in the last phase of mitosis. Beta blockers are medicines that reduce stress on certain parts of the body, such as the heart and the blood vessels in the brain. They lower blood pressure, protect against heart attacks, and can improve the outlook for people with heart failure. Congenital heart disease are defects in the structure of the heart or great vessels that are present at birth.
Congenital heart conditions. A congenital heart condition is a problem with the structure of the heart, which develops before a baby is born. The most common congenital conditions include a hole between two of the heart's chambers, septal defects, narrowing of the body's main artery, coarctation of the aorta, narrowing of the pulmonary valve stenosis. These affect almost 1 in 100 births in the UK. In most cases, a problem has occurred during the early development of the fetus. This could be due to a mistake in a gene, but in most cases there's no known cause. Most defects can be detected during pregnancy, but some are not found until a baby is born. Less serious conditions may not be spotted until much later. Symptoms in babies or toddlers can include a blue tinge to the skin, poor feeding, breathing problems, extreme tiredness, rapid heartbeat, excessive sweating, and chest pain. Treatment depends on the individual and the condition. Some only require regular medical checkups, but others may need medication or surgery. There is evidence that some congenital heart conditions can run in families. The BHF is funding research about this.
Cytokinesis is the phase of the cell cycle during which the cytoplasm actually divides. It follows nuclear division and involves the splitting of the cell into two cells. In animal cells, cytokinesis is achieved by a constricting belt of actin filaments interacting with myosin. As the filaments slide past one another, the diameter of the belt decreases, pinching the cell and creating a cleavage furrow around the cell's circumference. Constriction proceeds and the furrow deepens until it eventually slices all the way into the center of the cell. At this point, the cell divides in two. In plant cells, membrane components are assembled in the center of the cell to form the phragmoplast. These components are vesicles derived from the Golgi apparatus. The vesicles travel along microtubules, and their content forms the cell plate. The cell plate continues to grow outward until it reaches the cell membrane along the perimeter of the cell. Cellulose contained in the vesicles is then laid down between the new membranes, creating two new cell walls. Pectin is also deposited in the space between the daughter cells.
Applications in medicine. The cardiomyocyte and cytokinesis study results showed that the failure of cardiomyocytes to complete the last stage of cytokinesis is a feature of the tetralogy of Fallot, and that this failure is linked to adrenergic signaling. Adrenergic signaling is a heart disease component of the sympathetic nervous system, and the natural ligands, epinephrine and norepinephrine. In other words, the heart expresses all adrenergic receptors. That's why heart diseases are treated with beta blockers to prevent heart failures.
Your heart pumps blood around your body through a network of blood vessels, known as the circulatory system. Your blood then supplies the cells in your body with the oxygen and nutrients they need. If your doctor has prescribed you beta blockers, such as atenolol or bisoprolol, it may be because you have an abnormal heart rhythm, or angina, or heart failure, or had a heart attack. Beta blockers work by blocking the actions of hormones called adrenaline and noradrenaline. These hormones make the heart beat faster and with more force. Blocking them makes your heart beat more slowly and with less force, which reduces your blood pressure and the strain on your heart. Before you stop or change any medication, even if you're worried about side effects, talk to your GP first, as changing or missing a dose could harm your health. For more information about beta blockers, visit bhf.org.uk/beta blockers.
Pros and cons. Pros. Studies show improvements in heart diseases like hypertension, benign prostatic hyperplasia, and cardiac hypertrophy by treating patients with beta blockers, such as alpranolol and nadolol. Cons. Patients don't show a lot of improvements if they are major of 55. Also, some patients have consequences and secondary effects when they are treated with beta blockers. Issue applied in Ecuador. In Ecuador, heart diseases are common in medical consults. Genetic diseases like failures in the cytokinesis of cardiomyocytes cannot be detected on time because of the lack of genetic medicine. However, Ecuador have drugs like ACEI and ARA2 that are beta blockers, and they are indicated for the specific treatment of high blood pressure. Since they help control high blood pressure, they are also used for other implant cardiovascular pathologies, such as heart failure or coronary heart disease.
Hypertension is a term used to describe high blood pressure. What blood pressure is a measurement of the force of the blood as it pumps through your arteries. A normal blood pressure is 120/80. The two numbers in a blood pressure, the top number should not be greater than 120, and the lower number should not be greater than 80. The top number is called your systolic blood pressure, and that is the measurement of the force in the arteries as your heart pumps blood. The bottom number is called the diastolic blood pressure, and that is the measurement of force in the arteries when your heart is at rest. Anywhere from 120/80 to 140/90 would be considered pre-hypertension. Pre-hypertension often leads to high blood pressure, hypertension. Anything greater than 140/90 is considered high blood pressure or hypertension. The people at greatest risk for hypertension are African Americans. Also, if you have a family history of hypertension, and that's why it's important to know your family history. People who are obese are also at great risk for developing hypertension. And long-term stress increases the risk for hypertension. Smoking cigarettes, taking drugs, both street and over-the-counter medication, are risks for developing high blood pressure, and diabetes also puts you at risk for high blood pressure. The symptoms of a high blood pressure are sometimes very vague. It could be something just as simple as a headache, also confusion, any visual disturbances. Sometimes nausea and vomiting could also be a sign of high blood pressure, and nosebleeds. However, it's important to know that hypertension is called the silent killer because you may be walking around with a very, very high blood pressure and have absolutely no symptoms at all. That's why it is wise to have your blood pressure checked frequently, because although you may be feeling perfectly fine, you could have high blood pressure. Well, there are many causes of hypertension. Some of the greatest causes would be conditions of the kidney, conditions of the blood vessels, and of the nervous system. Increased cholesterol also contributes to hypertension, and of course age. As we age, our blood vessels become stiff, and that increases our blood pressure. The water and salt ratio in our body contributes to high blood pressure, and also certain hormone levels would also contribute to high blood pressure. Thank you for choosing St. Peter's.
Conclusion. In conclusion, birth defect diseases are important to treat on time and to diagnose on time for better results in the future. Cytokinesis in heart cells are essential to prevent heart disease and also to prevent patients from being condemned to take pills for their entire lives, such as beta blockers, who act in adrenergic receptors that are present in the heart.
Okay, so you've got a question about the side effects of a beta blocker type medication. These medications include metoprolol most commonly, but also very commonly bisoprolol, atenolol, nebivolol, propranolol, anything that ends with lol basically. There are several others. This type of medication is very commonly used in people after they've had a diagnosis of heart disease, be it a heart attack or angina, and also used in many patients with high blood pressure and among other problems. So it's a very common type of medication. If you look at the list of side effects, like with anything, you'll see hundreds perhaps of possible side effects. But the most common things that we see on a day-to-day basis are fatigue. Definitely the medicine can cause fatigue in many patients. Sometimes people get used to it and they're able to continue, but at other times medicine needs to be decreased or switched to a different one. Some patients respond better to one beta blocker type medication compared to another. Beyond fatigue, there's certainly lightheadedness. Some people feel lightheaded with standing or exercise. That occurs occasionally. Slow heart rate can happen with this medicine. Sometimes people notice that when they're exercising. Strange dreams can occur with it. It can cause erectile dysfunction in men. Certainly, that's a very common thing. So those are some of the typical side effects that we see with a beta blocker type medication.
Thank you so much for watching.